My wife wanted children. We had gone through a lot of infertility procedures. We got to a place where she just said, that she didn't want to do anymore.
Julie and Clayton are a wonderful example of a family who has a very wide variety of characteristics they're willing to accept. Medical needs don't scare them off at all.
We got Xavier first. He had to be weaned off of his drug exposure through methadone treatments. Nicholas was born with birth injury. He's just had lots and lots of care needs. And the decision came for us to adopt them. It was, yes, we will.
The beginning of 2017 marked the time when the state required all children that were in the foster and adoptive population to be part of a managed care organization. Here at CareSource, we put an entire program around those special populations.
When I met the family, I spoke to Fairfield County Children's Services about the child's history and the child's needs from their perspective. Not too long after that, after our consents were in place and I had permission to speak to Clayton and Julie, I made phone contact with them for a welcome call to welcome them to CareSource and to welcome them to our care management program.
CareSource would do all of those things basically to try to not only figure out what their needs were going to be, but what they were.
Having that one-on-one relationship with them where Clayton and Julie knew that they could call me directly if they had a concern, if they had a question, or if they had a need.
That's really what insurance, good insurance, does, is allows you to focus on things that are more important.